Here at the Safer Care Victoria Giant Steps Conference in Melbourne. We're up to day 2 and just doing some vox pops in the morning. Would you be so kind to introduce yourself, please, Lynn?
I'm Lynn Sinclair. I'm the Director of Clinical Services at the Cohuna District Hospital.
And what are you here with interest in? What's brought you here?
Very interested in the work of Safer Care Victoria and how we're improving safety and quality for all of our patients in Victoria.
What are the big issues out there in rural and regional Victoria?
Where do we start?
Yeah.
Workforce. Workforce is one of our major issues.
For safety?
Just to fill our roster, so that is for safety, yes, definitely. We're having issues recruiting nurses and midwives. We have a maternity service at Cohuna, and we've got lots of shortfalls on our roster. So just trying to think outside the box of how we can attract registered nurses and registered midwives to Cohuna.
Is that going to be a regional issue to solve, or are you looking for statewide supports?
We're looking at it regionally, but I would love to have some more statewide support. I think it's an issue across all of country Victoria.
And country Australia, really.
Attracting staff, yeah. We're in the middle of a drought, so we've got stressed communities, and it's very difficult to attract staff to a town that's already stressed.
Well, how does that manifest? What happens with that? Do people realise that it's tough and they don't want to come? What is it? Well,
it's very difficult to attract a midwife or a nurse who has a partner in the main employment, because employment's an issue. Even accommodation. It's very difficult to get accommodation. We've got fantastic schools and facilities in our town, a very community-minded town, always has been, because both Wendy and I are born and bred. And Christine is born and bred too in Cohuna. So we've all come back to work basically at the hospital. And yeah, we've got a great community, but everyone's just community stressed.
Great. Not great, sorry, but thank you for sharing. Takeaways from yesterday here at the conference?
It's great to be networking. We always learn from other people. And it's great to look at the posters and to listen to some of these dynamic women who've been presenting. Some of them have been amazing. What were standouts? I was inspired by the consumer story that we had yesterday morning with a girl that had...
It was Sarah Hawthorne.
Yes, Sarah Hawthorne,
who got flu and went into a coma.
An amazing young lady, and what a wonderful outcome for her and her family. So we're always concerned about when we hear stories like that it could happen to us, because we are very remote, really. Our closest, biggest hospital is Bendigo, which is an hour and a half. Then we have to get an ambulance anyway, so we have issues with transport sometimes, getting patients out.
Okay, well that's great to hear. Thank you very much. And I'm going to shimmy around past you
can do that.
To your colleague, Wendy.
Yes.
Wendy, could you introduce yourself and your role?
So my name's Wendy. I'm Nurse Unit Manager at Cohuna District Hospital.
And what stood out for you yesterday?
I loved the inspiration of those strong women who were our trailblazers, who've gone before us, but I loved hearing their story.
So can you name them for people who weren't here?
Annie Malden, I believe it is, paediatrician, who was actually who's received an Order of Australia medal. She has been involved in the inaugural chair of a quality committee in paediatric quality and safety, and she actually mentioned our hospital. We trialled an initiative that she started, and we've continued on with it. So that was wonderful to meet the woman who was involved in that.
What was that trial?
The Victor chart. So they're observation charts where we can do a set of vital signs on the child and know immediately whether they sit within acceptable parameters or whether they actually require urgent medical attention. We don't have a lot of paediatric training in our little awesome dynamic rural hospital, but this chart guides us. We can immediately know we need help now, or in 10 minutes, or in 10 minutes.
Great, thanks Wendy. What about the issues on your mind here today?
Yeah. So my role at the moment is as a nurse unit manager job sharing. I'm also going to be becoming involved in occupational health and safety, primarily around staff wellness. So a lot of burnout. We have got a workforce that's in their private lives, there's rural issues, and then with a workforce where we're multitasking, we are required to deal with anything that comes through the door, and with a workforce that's under a bit of pressure. So I would like to really look at how we can attract and retain and look after the wellness of our staff.
Are they around the wellness issues? Are they similar to what Lynn's told us?
So I won't repeat too much about that because Lynn covered that beautifully. But that'll be, and so today there's been sessions yesterday and today around finding joy in work, and that was so special. The little taking those little pauses where you can have a breath and look after yourself, things like that. We were able to workshop, speak to people from other regions, network, mix. What do you do at your hospital? What works for you? Okay, I'm going to do that. I'm going to go home and do that.
Fantastic. Thank you very much, Wendy. Thanks. Now I'm just going to go around the table, walking around. No, thank you very much. And perhaps I'll just stick first with the hospital. Christine, would you introduce yourself, please?
I'm Christine Trevina. I'm the midwifery unit manager at Cohuna District Hospital. I'm new to the role, so started in February this year, so have learnt a lot in the last 11 months.
You're a local though, so
I'm a local.
What were you doing until then?
Prior to that I was nursing at the hospital. I'm a nurse and a midwife. Prior to that I was selling shoes and jewellery and all that fun stuff. So I've had a very big change in lifestyle.
Great. So what issues have you brought on your mind to this conference?
The biggest one and the most that I have focused on has been burnout and preventing that in the workplace. We have a very stretched midwifery service at the moment with reducing midwife numbers, an increase in governance around midwifery, which is important obviously for safety, but just making sure that our midwives and the nurses who work with those midwives are safe and we avoid burnout and we avoid stressed staff members.
What stood out for you at the conference yesterday?
I had a brilliant day with Dr. Mays yesterday, and hearing his story about burnout, and Dr. Tag as well. Hearing his story, drawing our lifeline was brilliant, like what has shaped our life, You did
that in that session?
Yes, yeah.
And what was the point? What was that about? Yes, I saw a bit of the dance on Twitter. Tell us about it.
Dr. Mays started attending a dance group in Castlemaine, so he brought a little bit of that spice to this session yesterday. Loads of laughter throughout the room and it completely changed everyone's mood in the room, which was really good. And just stressed the importance that, yes, we're health professionals, yes, we strive to be perfect, but we also have to take care of ourselves as well.
Fantastic. And any other takeaways looking forward to today?
Christine Nixon yesterday was brilliant as well.
Why was that? She's the former police chief in Victoria?
Because I took this job on because, why not, I'll have a go. And felt like a bit of an imposter to start with. Now I feel I'm starting to find my feet, and just knowing that these women who have had amazing jobs across all
Fields.
areas have sometimes suffered from imposter syndrome as well, and have still just kept trudging through and making the changes.
Fantastic. Thank you very much for sharing. And finally, we get to Sarah.
Sarah.
Hi.
Hi.
Could you introduce yourself and your role?
So I am Sarah Watts. I'm the Loddon Mallee regional midwife in the perinatal support program. I was employed by the Loddon Mallee Clinical Council, which has been supported by the CEO's group, which my role was recognised as a need along with the regional obstetrician. After the Targeting Zero report came out, that was one of the priorities.
So that was an issue of unavoidable deaths at Bacchus Marsh?
Yeah, so that was my previous role to this. I came in after that was all known about, and supported that service for just on 3 years to regain its focus and governance and risk assessment. And,
can you talk about what that involved and what it's achieved? That was a very traumatic
It was
experience
very
for
traumatic.
Victorian healthcare.
It was.
And the families?
I guess the important thing is that while that was one service that was under the spotlight, it could have happened to many services around regional Victoria. And for some of the reasons that have already been spoken about, reduced workforce. I was at Beechworth last week where they said the average age of a midwife is 54 in the regional areas and across the state. So that's a real issue because, women like myself are heading towards retirement, but there's no backfill coming through. So we have to have a look at what we do in that area and just increasing knowledge for all staff around risk assessment, and that's the important thing in maternity is risk assessing your woman at every step of the pregnancy, and when the risk changes, referring that woman to an appropriate service, and that's a really important lesson that's been learned across the whole region.
Have you got a lot out of being here so far? What are the?
I have. So part of my role is quality and safety, and governance. So it's really good to listen to other people's stories about how they've achieved that in their own workplace and not always in the maternity space, because I'm very focused on maternity, but we can gain lots from our colleagues. Especially around yesterday, I listened to the CEO speak for us about their consumer involvement and volunteer involvement up there in Oyen and the Mallee track.
I heard that one, that they have 46% involvement, but that risks fatigue because they're consumers and volunteers.
Absolutely, yeah. But I think that the one thing I took away from that was that you don't always have to have a committee, that you can just be engaging with your consumers on a day-to-day basis in many different ways.
Does that raise concerns for you, though, about process? Is there a need for that process?
I think in some organisations, yes. Some of the larger sites don't have as many volunteers as some of the regional sites do, and lots of regional organisations have a lot of community involvement in their services, so they're probably better placed to do it as they go along, whereas I think some of the bigger organisations really need to have that structure in place, because the potential is that they would get lost. I think that we really need to look to our consumers to improve our healthcare, because they're the ones using the service, and we can only assume what they know or want, and it's important to get their story.
How close are you to doing that where you are, in a way that's...
So it varies across the region. Some areas are more advanced in that process and others are just at the beginning stages, but it's on everybody's radar that this is where we need to. I was at the persona. They spoke about having a persona, which is having a person that you, not a real person, but a person that you would say, what would Mary do? What would Mary want? How would Mary want this to happen to her? And having that one focus, I think, is really good.
Fantastic. Any other reflections?
About looking after your workforce, looking after the workforce that you've got, nurturing that and, taking care of them, because if you don't, they'll go. They'll move into different careers. And I think that's really important for our younger generation. In my own household, I've got people that range from 21 to 27 and are constantly told, well, of course, if you don't like something, we'll just move on to the next thing. So we have to really nurture our young workforce and ensure that they stay with us for the long term.
Fantastic. Thank you very much, Sarah.
You're very welcome.